Greetings to the deaf and hard of hearing constituents of Rhode Island. This is the press conference from December 15th, 2021. I am Governor Daniel McKee. I stand here with Dr. Alexander Scott from the Department of Health. I'd like to thank all of you for attending today's meeting. The meeting is very important. I have some information to disseminate to all of you, so please listen carefully and help me get this information out to as many people as you can, because this information is new. I just signed an executive order 21-116, which focuses on the requirement on two categories: masking and vaccination, which I'm about to explain a little bit more in the next few minutes. But before I have this discussion, I would like to show you a graph in reference to the data that we've collected of the positive rates and how many people are in the hospital as of this time. So the two graphs that I want to show you, I would like for you to take a look at very closely at this time. So if you look at the top graph, those are the new positive cases that have been coming in on a daily basis as those compared to on a weekly basis. The bottom graph shows the hospital rate of how many beds are now being occupied. So that's very important that we watch these numbers. So for the last few weeks, we have seen an escalation. And so if you look at the numbers, you can see that the numbers are going up. And the yellow bar on the right basically represents a daily basis of how many COVID cases are coming in. As of on a daily basis, as of Monday, we received 1,444 new cases, which is very high. But if you look at the blue line, that represents what's happening on a 7-day average of positive rates. So as of December 14th, we're averaging over 1,000 new positive cases per week. That is extremely too high. Historically, we were getting between 100 to 300 on a weekly basis in the past. Now, the CDC requires that we have less than 100 per 100,000 people on a weekly basis. We are now at 1,000 out of 100,000 people. So it is showing that the variant that's taking place now is still around, and it's because of the Delta variant, these numbers are rising faster. Now, if you look at the bottom graph, that is related to the patients that are hospitalized occupying the beds. As of December 14th, we now have 280 new patients occupying these beds. Okay, that is throughout the state of Rhode Island. 280 beds are now being occupied by COVID-related cases. That is equivalent to 52% of the same day that we've had in 2020. When COVID first started 1 year ago, we wanted to have a goal so that we would not hit that number of 70% and above of hospitalization by COVID-related cases. We wanted to keep that number below 70%. And the reason why is because we wanted to reserve 30% for patients that were going into the hospital for unrelated cases that were not related to COVID. So let me give you an example. If that 52% that we have now continues to escalate in the next few weeks, and we go above 70%, this means that we are going to have to cut back on services for non-related issues to COVID, where they may have to be postponed because of all the patients that are occupying the bed that are COVID related. Also, I have been informed that there has been a shortage of healthcare providers, doctors and nurses, since last year. We have less staffing issues. A lot of people have left their jobs, a lot of people have been burnt out, and a lot of people have moved into other positions and new jobs. So there is a strain on the medical field as of now in terms of first line responders. So I want to get this information out now so that we can be prepared for what's ahead. Dr. Scott has also told me that there are some other statistics that we need to share. Now, for the new positive cases that we've been getting recently, this shows that people who have not been vaccinated are the ones that are more likely to get infected, 4 times likely than those who have been vaccinated. So for example, if you have 10 people that are positive, 8 or 9 people out of that 10 are the ones that are unvaccinated, are the ones that got contaminated. So that shows that the vaccination does work and it does protect you from COVID-19. Now, when we speak about the hospitalization beds, I want you to take in consideration before you go into the emergency room, think about why you're going into the emergency room. Because we want to keep the emergency room as less busy as possible for unrelated cases of COVID so that we can be able to treat those who are treated with COVID. Okay, because we know that those people who are unvaccinated will more likely be coming to the hospital and staying in the hospital, where other people who have been vaccinated, if you're coming for a matter related to COVID-19, you'll probably be treated and then released to go home. So this is going to create a new challenge for us, how we handle this. But based upon the information, I've decided to sign the executive order to curtail the positive rate from going up. The executive order that I just signed, 21-116, as I said previously, focuses on masking and vaccine. So let me explain about the vaccine first. As I've had discussions with my colleagues and teams from the Department of Health, we have a category of 3 different categories where masking will be mandated. Again, this is not voluntary, this is mandated. In any venue, sporting event, indoor recreational event, including places of employment or restaurants and movie theaters that have a capacity of 250 or more, it will be required that you will need a mask, regardless of whether you are vaccinated or not, such as a shopping mall, large venues where people are congregated. Now, any place that's less than 250 people for small businesses, churches, perhaps maybe small schools, it'll be up to the business service provider or the hospitality facility to decide whether they will require masking or not. However, even though it'll be their decision to do so, those who are vaccinated will now have to bring your vaccination card or proof of vaccination with you, so that if you are asked to produce that, you will be able to produce that before you're allowed to go in. In those situations, you may not be required to wear a mask for those type of settings where there's 250 people or less. If you are not vaccinated, you will be required to wear a mask in those environments. That's the second category. The third category is related to places of employment, business offices, government offices, small companies, and so forth, which is similar to category number 2. You know, above 250 people working in a business environment, they will be required to wear a mask regardless of whether they're vaccinated or not. If it's less than 250 people, it'll be up to the discretion of the managers and business owners or the retailers to decide whether one or the other will work. So in other words, if you're vaccinated, you may not have to wear a mask and so forth. But if you're not vaccinated, you will be required to wear a mask at work. This is very important because research has shown that the data that we have collected over the last 2 years have proven that masking does work and reduces the transmission of COVID-19. Keep in mind that we are now embarking in the beginning of the winter months, and more people are now going from outside and congregating indoors. So we expect that the rate of contraction of COVID is going to spread as a result of this. As I showed you in the previous slides, we need to bring these numbers down to keep them down because they are escalating. So masking does work. Now, talking about the vaccines, it is not mandated that you get a vaccine, but I am encouraging all of you to get vaccinated. Again, we have information that supports the fact that through the data we've collected over the last year, the people of contracting COVID have been less since the vaccination compared to those who have not been vaccinated. So the ones that are now going into the hospital and being contracted with COVID-19 are mostly from the people who are not being vaccinated. Now, the definition of fully vaccinated means that you've had 2 complete doses of your Pfizer or your Moderna, 2 doses of your Pfizer or Moderna, plus 2 weeks afterwards of waiting, you are considered fully vaccinated. The same thing with the Johnson & Johnson, which only requires 1 dose. After 2 weeks of your first dose, you are considered fully vaccinated. That is our norm and what has been our norm for the last year. However, the new norm may change because of what will happen now, because what we've decided to see now is that we have a 3rd dose known as the booster. The booster definitely protects against the Delta variant for sure. Now there has been a new variant that's come aboard, which is known as the Omicron. Now we don't know too much about this at this time. So it's too early to make a determination. But we know that the booster is definitely helping to protect us from the Delta variant for sure. Now, I'm not going to be surprised if this changes depending on what happens with the Omicron variant. But if numbers show that it is severely spreading faster, we may have to go to a new norm where it will require 2 vaccines plus the booster. Now, for those of you who have had your vaccines, get the booster. And for those of you who have not had your vaccines, please consider about getting your vaccines and then going on to get your booster as well. Now, for those of you who have children above the ages of 5 and above, please take into consideration about having your children vaccinated. Please. Now, the executive order that I put in place is a temporary executive order. It is not a permanent executive order. I will revisit this in 30 days after it goes into effect, which is December 20th, depending on what the numbers show us. So after 30 days, we will meet again. We will reevaluate the status of the numbers, whether we will continue with that mandate or not. But as of now, we are required and mandated to wear masking indoors, okay? And please start to carry your proof of vaccines with you in your pockets, your purse, whatever it may be. You can also take a picture of your vaccine card, which will be accepted as well. I also want to share some information with you that the state of Rhode Island, we are now partnering with the state of Connecticut and also the state of Massachusetts. And between the 3 states here in New England, we have contracted with a company that is developing an app for vaccine, proof of vaccine application. So when that's ready, we're probably going to have that ready in the next couple of weeks. We are going to make that information available to you. Please use that app, because that app will basically be a good place for you to access your vaccine records from the Department of Health. And they will all be the same between Massachusetts, Connecticut, and Rhode Island, which they will accept that app. So please keep an eye on more information related to this app as it comes out. And as this app becomes available, I will share that information at that time. We are now embarking on Christmas holidays, New Year's, and the numbers are now going up, as you can see from the previous charts I just shared with you. And most of those numbers are really, are being attributed to those who have not been vaccinated. And this is a result of what has just happened from the Thanksgiving holiday. Now numbers have been going up over the holidays. We saw that because what happens is we get relaxed, we take our mask off, and I am encouraging you, this is not the time to let your guard down, but to double down and use your mask, especially if you have not been vaccinated. And when you're indoors, wear your mask. Protect yourselves, protect others, okay? Protect our children. Thank you.